I heard that Medicare Supplement Plan F is the best. Should I purchase that? Plan F is the best. It's the most comprehensive plan. It covers everything Medicare doesn't cover. And the beautiful thing about it is, the bottom line is when you go to a doctor who accepts Medicare, whether he or she accepts Medicare assignment, you're not going to pay a penny. So whatever Medicare covers, Medicare determines the benefits. Plan F, which fills the gaps, has to fill every single gap. So you aren't going to pay a nickel. You're not going to have to worry about it. Paperwork as far as your explanation of benefits and co-pays and all that great stuff that no one wants to deal with. So it's hassle-free. It's an amazing plan. That being said, let's talk about a few other plans for a minute. For example, a lot of people in my office like Plan N. Plan N is about a third less premium than Plan F. There's 4 benefits that Plan N does not have that Plan F does have. The first 3 are pretty minor. One is a $50 emergency room copay, which gets waived if you're admitted to the hospital, and that's not going to happen very often. The second one is your Part B deductible is not covered with Plan N, which it is with Plan F, but that's only $166. So that to me is not a huge amount of money compared to the savings in premium that you save. The third difference is the copay. With Plan F, you do not pay a nickel to go to the doctor. Plan N, once you satisfy that $166 deductible, then you have a $20 copay. The fourth difference, now that to me is what is significant, because, and it also brings into light something that I think is just a great idea for everyone to know between doctors, because there's 2 types of doctors that accept Medicare. Those who accept Medicare assignment and those who don't accept Medicare assignment. Now, if you accept Medicare assignment, what that means is whatever Medicare allows you for a procedure, the doctor has to accept that as payment in full. So for example, let's say you went to the dermatologist and the dermatologist wants to remove a little tiny basal cell carcinoma off your nose. Let's say the dermatologist charges $1,500. Okay. If Medicare allows $1,000 and the doctor accepts Medicare assignment, they have to write off that $500. So now Medicare is going to pay 80%, your Part B, of the $1,000, which is $800, and your supplement, say your Plan F, will pick up the 20%, the $200. You don't pay anything. On the other hand, if you had Plan N, it picks up the 20%, which is the $200 minus the $20 copayment, but it doesn't pick up what's called excess charges. If the doctor accepts Medicare, but he or she doesn't accept Medicare assignment, they're allowed to charge up to a maximum of 15% additional beyond the Medicare allowable. So what that means in this example, if the doctor charges $1,500, Medicare allows $1,000, he can charge or she can charge an additional $150. So Plan F would pick up that $150, Plan N would not. Now in this case, a specific example, again, $150 is not a huge amount of money, and you could even make an argument that in most cases you're going to be ahead in your Plan N. In most cases you are. But it's important to remember, even if we check, in my office we check for you, by the way, if your doctors accept Medicare assignment. But remember, your Part B medical in the hospital, even though your Part A is your hospital, that again, that's facility charge. Your surgeon comes under your Part B, and chances are you're not going to know whoever that surgeon would be for a surgery you might need in the future. And if that surgeon doesn't accept Medicare assignment, you could be responsible for 15%. And 15% of a real surgery has a lot more than 15% of removing a basal cell off your nose. So I want you to keep that in mind. And just for an example, one other plan, if you're worried about that excess charge, Plan G. That's awesome. It's more money than Plan N, but less money than Plan F. Covers everything Plan F doesn't, except your $166 deductible.